Welcome to the 2017 ESCO World Congress of Osteoporosis and International Osteoporosis Foundation Annual Meeting Congress Highlights in Florence, Italy. My name is Dr. David Kendler, and I'm a professor of endocrinology at the University of British Columbia and the co-chair of the Congress Highlights Committee. At this large international meeting, there are more than 4,000 registered delegates and almost 2,000 submitted abstracts. In this brief video, I will present to you just a few of the overall highlights of the meeting, hopefully motivating you to look further into this package, which reviews cutting-edge research and symposia discussing topics of interest to clinicians treating patients with osteoporosis and musculoskeletal disease. In the opening keynote lecture, integrated care for older people was encouraged to promote successful aging. Other lectures identified the need to target patients at high imminent risk of fracture for effective osteoporosis management. The SCOOP study demonstrated that FRACs without BMD can be used to identify patients at risk of fracture in a primary care setting, with resultant reductions in hip fracture incidence in patients enrolled in the program as compared to conventional care. Interestingly, in another presentation, it was observed that fermented dairy product consumption was associated with attenuation of cortical bone loss independent of total calcium, protein, or energy intake in postmenopausal women. At this year's meeting, we saw further data to help define the role of bone anabolic therapy in the management of patients with severe osteoporosis. The VERO study randomized postmenopausal women with moderate or severe vertebral fractures to either teriparatide or risedronate for 2 years. This study demonstrated for the first time in an active controlled head-to-head clinical trial with fracture as a primary endpoint a further 50% reduction in vertebral fractures and clinical fractures in patients randomized to the anabolic teriparatide as compared to the anti-resorber risedronate. In another analysis of 4 separate prospective observational studies of teriparatide, it was shown that there was a consistency effect in reducing clinical fractures in different patient populations around the globe. We also saw data involving other anabolics. Abaloparatide was demonstrated effective in preventing fractures in multiple subgroups of women in the active study. In addition, data were presented to confirm efficacy in postmenopausal women at high risk of fracture by FRACs. Romosozumab was demonstrated to be rapidly and highly effective even in elderly women over the age of 80. The pivotal fracture study on romosozumab in postmenopausal women with osteoporosis demonstrated vertebral fracture efficacy in the first year against placebo and ongoing benefits as patients were transitioned to denosumab in the FRAME study. Denosumab was also shown to be effective in improving bone mineral density to a greater extent than risedronate in patients with glucocorticoid-induced osteoporosis. It was confirmed that discontinuation of denosumab leads to return of fracture risk to pre-treatment levels. Bone biopsy studies in patients after 3 to 5 years of denosumab and after 10 years of denosumab do not demonstrate progressive increments in bone mineralization. There were also interesting plenary lectures. Dr. Dawson Hughes presented on calcium intake worldwide, drawing a focus to this important nutritional aspect of bone health. I hope you'll enjoy reviewing the Congress highlights and benefit from the scientific material which we've attempted to summarize in this package.